Hi, my name is Courtney Crowley, and I am a nursing student at the University of Michigan. I am going to present a patient from clinical at Heartland Medical Center. Patient is a 50-year-old male, divorced Caucasian who appears stated age. He is a retired mechanist and carpenter and also a disabled veteran. Upon taking his vitals, they are stable. His blood pressure is 125/75. His heart rate is 77 beats per minute. Respiratory rate, 13 breaths per minute. His temperature could not be taken at time of assessment. Patient was admitted to Heartland for secondary progressive multiple sclerosis. Patient was diagnosed with MS 25 years ago. He rates his pain as 8 out of 10 for intensity, with most of his pain coming from his left side and lower extremities. He needs extensive assist and uses a scooter. His past medical history includes multiple sclerosis, hypertension, neurogenic bladder with suprapubic catheter, Raynaud's disease, dyspepsia, depression, and insomnia. All immunizations are up to date. Patient has no known drug allergies. Past surgical history. Patient was not able to remember and verbally state any past hospitalizations or surgeries. His chart states that a past surgery includes a valvoplasty of mitral valve with cardiopulmonary bypass. Patient is on multiple medications for chronic pain, hypertension, depression, urinary tract infections, insomnia, and multiple sclerosis. Functional assessment. Patient is allowed to have 1 beer a day. However, he states he usually forgets that he is allowed to do so. Patient states that he does not have an exercise routine because he hasn't done physical therapy since he has been at Heartland for 3 years. Patient has difficulty sleeping and takes 3 sleeping pills to help. Patient does not enjoy the food at Heartland and states that everything is too salty. Patient admits to ordering food in often. Patient was a smoker, but recently has quit. Patient drinks caffeine in the morning only. Psychosocial. He is the youngest of 4. His sister and brother-in-law visit him often. He lives in a home in Tecumseh, Ohio. He has been divorced 3 times and is currently divorced. He has 1 son and is a Catholic. Family history. His dad had a heart attack. A high priority system for this patient is musculoskeletal. Upon review of system, musculosclerosis was diagnosed 25 years ago. Patient did not state aggravating or alleviating factors. Patient just stated that he is constantly in pain, and it interferes with daily activities greatly as he uses a scooter to get around and is unable to use his left side at all in both of his lower extremities. Patient is able to feed himself. Associated symptoms include weakness, tingling, numbness, blurred vision, and urinary problems. Client keeps a positive attitude and included numerous jokes throughout the exam to lighten the mood. Upon musculoskeletal physical exam, he was limited because patient was unable to stand up without assistance from a certified medical personnel. Bone structure was in normal ranges. Muscle mass appeared to be decreased in lower extremities. Patient appeared to have erect posture while sitting up. Patient's TMJ, neck, shoulders, elbows, and wrists did not appear to have erythema, warmth, pain, or crepitus, and range of motion appeared normal. Patient had localized weakness on left side compared to his right and in both legs. I would expect to find lower extremity joints to be stiff due to lack of usage and their muscle strength to be 0 due to paraplegic. Secondly, a neurological exam is also a high priority. Patient stated numbness, fatigue, and dizziness, depression, and disturbances in vision. He started to feel tingling in his lower extremities and started to experience bowel problems. In an effort to treat this problem, he received a prescription for glasses and eventually saw his primary care doctor. Upon physical exam, patient appears well-groomed and alert and oriented times 2 to 3. Patient's facial expressions and speech patterns are normal. Patient's attention span, short and long-term memory, abstract reasoning, intellectual ability, judgment, and thought processes are all normal. Due to patient's extensive assist, patient was unable to be tested for gross motor imbalance, Romberg test, and lower extremity fine motor. Patient's light touch sensation and painful sensations are normal on upper half of body, but nothing was sensed on the lower half. Stereognosis, graphisia, and proprioception were all intact. Babinski and ankle clonus reflexes were not demonstrated due to patient's paraplegia. Patient was able to complete the cranial nerve exam. Patient's olfactory nerve was intact and able to smell hand sanitizer. Patient's visual acuity and fields were in normal range, suggesting patient's optic nerve intact. Patient's oculomotor, trochlear, and abducens nerves are all intact as his pupils are equally round and dilated. Patient's trigeminal nerve is intact, and his masseter muscle strength was normal and sense of light touch was normal. Patient's facial nerve was also intact. Patient was able to hear the whisper test equally in both ears, suggesting that his acoustic nerve is intact. Patient's uvula rose equally, indicating an intact glossopharyngeal nerve. Vagus nerve was intact. Spinal accessory nerve was tested and found also intact, as he could shrug his shoulders and move his head side to side. Lastly, patient's hypoglossal nerve was tested, and he was able to protrude his tongue, move it side to side, and say light, tight, dynamite, indicating that his hypoglossal nerve is intact. In addition, there are two other pertinent systems that I would examine based on my patient's health history. A cardiovascular exam is pertinent. According to this article, Multiple Sclerosis, in the American Journal of Nursing, it is important to assess the patient's heart sounds because he may be at more risk for heart problems due to multiple sclerosis's effect on involuntary bodily processes such as breathing, digestion, and heart failure. Staying active helps promote a healthy heart, and multiple sclerosis affects a person's ability to remain physically active. Furthermore, patient has a history of a recent cardiovascular surgery, and it is important to be aware of its progress. I would perform a cardiovascular exam in order to inspect, palpate, and auscultate for normal findings and abnormalities. Secondly, a peripheral vascular exam would also be pertinent. According to Johns Hopkins Medical Online Health Library, it is important to perform a peripheral vascular exam because patient may be more at risk for circulatory problems related to his diagnosis of Raynaud's disease, hypertension, and lack of exercise. Raynaud's disease is a condition in which fingers, toes, and the tip of a person's nose or ears feel numb in times of stress or cold temperatures because smaller arteries that supply blood to the skin are narrowing. In testing Raynaud's disease, a nail skin fold test may be performed along with capillary refill.